Hi everyone, my name is Nick Page. I work within the Decipher Centre, and my role within Shern is principally as Shern's data analyst. Today's presentation is just going to talk to you about the School Environment Questionnaire, or SEQ for short, specifically in terms of what it is, why it's so important, and how your school can get involved with data collection if you haven't been in the past. So just briefly, hopefully everyone will know that one of the values of Shern is the data that we collect. And we have two biennial surveys. We have our pupil survey and we have our school survey. And the school survey obviously is the SEQ. So the value of these two surveys in combination is that they provide quite a robust data infrastructure in terms of they collect data on school level policy and practice, and then we can assess that in relation to student outcomes. The value for schools is that we provide tailored school feedback reports, and some schools can obviously use this data within their school development plans. And from a national level, the data has been used to inform national policy implementation and also evaluation. So what is the SEQ? So the SEQ, as I've said, is our school level survey, and it collects data on the policies and practices. So we are really thinking about sort of the whole school environment. Most recently, our data was collected in between January and March 2020, and our next survey in 2022 will go out similarly between January and March. In 2020, we had 165 secondary or middle schools that completed the SEQ, and this included 5 independent schools. But of the maintained schools in the sample, so the 160 schools, these are representative of all schools in Wales with respect to the size and the level of free school meals as a measure of deprivation. And you can see from the table at the bottom these particular indicators. So of our 160 schools, our average free school meal entitlement was around about 17%. And this was slightly lower than the non-participating schools, which was 19%. So the non-participating schools may be very, very slightly more deprived. We also have a supplement section in each survey round, and in 2020 the supplement focused specifically on the curriculum for Wales in terms of schools' preparedness. We've had good sample growth in the SEQ. So from 2013 we had 52 schools that completed, and as I've said, in 2020 that was up to 165 schools, and we'd hope in 2022 to do better again, as we have over 200 schools who are registered to complete the student survey, which is currently in the field. So the SEQ is partly based really on the Health Promoting Schools framework. So the World Health Organization's HPS framework emphasizes a whole school approach to promoting health and educational attainment by capitalizing really on the organizational potential of schools and how schools can foster those conditions really to encourage positive health and educational outcomes. So the sort of characteristics we're looking for are healthy school policies, healthy physical environments, healthy social environments, healthy skills and education, good links with parents but also the wider community, and importantly access to school health services. And you can see from the diagram that's presented, this is sort of the interrelationship between some of those key elements. So really the why of the SEQ, in terms of why is it so valuable, why is it so important for schools to complete this data? Well, we've already said that in combination with the student level data, it really gives us the opportunity to assess the links between school policy and practice and student health outcomes. And this is even more important following COVID. So this data that we're presenting now was literally collected just prior to the pandemic, and obviously, as I've said, we'll We're collecting our next round of student data at the moment, and our next school level survey will go out at the start of next year. So it's our real first opportunity to collect some data since, or currently during, the pandemic. So what I'm going to do is just to present a few slides now with findings from that sort of 2020 SEQ, kind of within the themes of some of the areas of the health promoting schools framework. So firstly, just organisation and leadership. And I've picked out a few key findings from the survey. So the survey itself is completed by the senior leadership team, and the most common priorities identified by the SLT in 2020 were educational attainment and student mental health and well-being. And interestingly, educational attainment actually had declined in terms of how much of a priority it was considered, from around about 85% of schools having it as a key priority in the previous SEQ, down to 74% this time. So over half of schools, 56%, reported having a single strategic lead for health and well-being. Of these, about 84% reported that this role was undertaken by a senior manager, so a head teacher, a deputy head teacher, or an assistant head teacher. And actually of those, the most common was the assistant head. 73% had a written school health and well-being action plan or targets, and the majority of these were included. Majority of these schools, included these plans or targets within their school development plan, and most assessed progress at least annually. In terms of who used the data, well, the health and well-being data was used mainly by well-being and pastoral care teams and the senior leadership team. Now, this isn't just the Shern health and wellbeing data that schools get as part of their feedback reports. This is health and wellbeing data in general that the school would collect. Interestingly, though, only 28% of schools shared data with subject teachers, so that's quite a contrast. In terms of another theme, looking at sort of curriculum, learning and teaching, with a focus specifically for this on PSC. So really, PSC or Welsh back lessons were most frequently used to deliver health and wellbeing education within the curriculum. And here we're talking about things like tobacco education, education on alcohol, drugs, physical activity. The main exemption to this really was healthy eating, and that tended to be taught more in food tech lessons. PSC was coordinated by staff really in a very diverse variety of roles. So only around about a third of schools that completed the SEQ reported using a specialist PSC teacher. And around about 1 in 10 schools actually had outside agencies that were responsible for delivering PSC. Teaching in general around PSC was most commonly delivered by tutors, but this was followed by sort of any classroom teachers, or that no group had overall responsibility. But actually around 6 in 10 schools, so 57%, provided no formal training to the non-specialist PSC teachers. So in terms of the school environment, so we're thinking here sort of school ethos, we had over half of schools reported involving students in health and wellbeing policy development, and this was always or most of the time. So we're thinking here of student involvement. Student involvement more generally, that was commonly at the stage of commenting on a draft policy. That was the most common involvement in health and wellbeing policy development. Slightly less was proposing a new policy, and slightly less again was developing a new policy. So they were the three most common roles that students would play in developing this policy. And actually 71% of schools reported their school council or a similar student-led body met more than 6 times per year. And actually of the sort of subjects that were discussed in these council or student-led body meetings, this was majority of the time it was food and nutrition, but also mental wellbeing was high on the agenda, and also bullying. So they were the three most common themes discussed during those meetings. And actually, 8% of schools reported that their school council did not meet the requirements of meeting at least 6 times per year. And something that I wanted to say in terms of that first point with involvement in health and wellbeing policy development, most schools reported this was done via consultations. So this is consultations with the school council or other student voice groups, or through wider consultations with students. This is how students were commonly involved. And another theme in terms of family and community, looking at a few of the measures that we have available, we had around sort of half of schools actually reported that they did not involve parents in health and wellbeing improvement decisions, although 15% of schools did include parents in identifying health priority areas. Parent governors, surveys and information evenings tended to be the most common means of involving parents, and around half of schools suggested they were dissatisfied with the current level of parent involvement, whilst around 1 in 10 schools claimed to be satisfied. In terms of partnerships with external agencies, specifically around improving student health and wellbeing, the most common partnership was with the police or PCSOs, which was in 92% of schools reported a partnership with those organisations. 82% with sport development officers, 81% with health professionals, and 79% reported partnerships with youth workers. So a diverse range of partnerships there, and these are only the most common. In terms of how to get involved, the 2022 SEQ, as I've said, will be soon in the field next year. It'll again be an electronic questionnaire, which will be delivered by our survey contractor, which is Ipsos Mori. This year, for the first time, schools will receive a copy of their survey responses, and the benefit here is that the SEQ can act as an internal audit for schools regarding their policies and practices. So by allowing the schools to receive a copy of the survey responses for their own records, this will allow you to compare with those national figures when they are published and made available on our website. Our supplement this time round will be COVID-19 experiences and recovery planning. The section itself was sort of co-designed with stakeholders, so this has included input from Welsh Government and Public Health Wales. And importantly, we've tried where possible to harmonise some of these questions with other surveys so that we can have some international comparison where possible. But they've been specifically adapted to the Welsh context, so they will be relevant to your experiences. So in terms of some of the other topics that are included within the SEQ that we've not actually covered in this presentation, so there'll be some more questions on curriculum reform. We ask around physical activity and active transport. We have a section on healthy eating, tobacco, drugs and alcohol. Important in the context of COVID, we have a section on mental health and wellbeing, and that asks specifically around staff and students. We have our section on sex and relationships, and then we have a section on health service provision. That's a very, very quick whistle-stop tour of the SEQ. If you have any further questions at all, you can obviously please contact the Shern team. The report itself from the 2020 SEQ is available on our website, and that's available via the link below. And the only thing I suppose left to say is, if you have not been involved in the past, please consider participating in the SEQ when it comes out next year. If you have participated previously, please do so again. The value really is immeasurable and so important in the current climate. And as you'll notice, hopefully from what I was speaking earlier, that we do tend to get more schools complete the student level data than we do the SEQ. And in order to really maximise the value of both surveys and the data we collect, it's so important that those schools complete both surveys if possible. Thank you.
I'm going to say a little bit about the importance of the school environment from a public health point of view, and particularly from the perspective of Public Health Wales. I'm Julie Bishop and I'm the Director of Health Improvement at Public Health Wales, and I have responsibility for a number of things, but including the work around education and health. Now, the concept of the school environment, a whole school approach, is nothing new. The WHO identified in its Healthy Schools programme that school environment was fundamental to health and wellbeing. And we've been using this approach in Wales, as you know, through our Welsh network of Healthy Schools scheme for some time. And they acknowledge that a school that implements a structured and systematic plan for health, wellbeing, and the development of social capital of all pupils, teaching and non-teaching staff be characterised as a whole school approach to health and wellbeing. And essentially that means that they're focusing on the whole school environment as the basis of that whole school approach. But it's actually nothing new. This quote that some of you may have seen, I've used it before, it goes back to 1934, and it was from a Dr. Salisbury, the Chief Medical Officer of the Ministry of Health and Board of Education at that time, talking effectively about school environment, talking about the importance of schools providing a civilising environment, somewhere to practice healthy habits, talking about ventilation, which is interesting given the experience we've had in the last couple of years, talking about toilets and hot water, again, something we'd be familiar with now, and, you know, properly served school meals, adequate playgrounds. On one level, we might say that that's quite disappointing, that we're still talking all of those years on about the same kinds of issues. But I think there has been some changes and there have been benefits, but perhaps as we've become more sophisticated in our thinking, we maybe can always be guilty of forgetting the basics, whether it's about our own health and well-being or indeed those of the people that we work with. Our colleagues in Public Health England did some work on looking at the relationship between pupil health and well-being and attainment, and they found that there was a clear relationship between the culture, ethos and environment of a school and the health and well-being of pupils and their readiness to learn. So there is actually a good research evidence base for what we're talking about in terms of the school environment. Sorry. The determinants of health and well-being are actually complex, but in some respects also simple. The diagram that's here is one that we frequently use in public health that talks about health being something that is a product of a number of different influences, from the wider environment, social factors, economic factors, and in this case, you know, really emphasising a global perspective. But what's fundamental is an understanding that health is largely a product of factors which are outside the control of us as individuals. And if you understand that, then you're well placed to actually think about how to improve people's health and well-being. And whilst this is a model thinking very much on a macro global level, you know, you can also apply it to settings such as schools or workplaces and think about how some of those concepts can be applied at that level. So all of the things that I've talked about so far really reinforce the importance of the school environment and therefore the importance of the school environment questionnaire in helping us and you to actually take action to improve health and wellbeing. And I'm just going to run through a few of those reasons now. I think the first thing for us is we want to be able to understand change over time. We want to be able to understand that the school environment is not static. We want to be able to see the changes that are happening purposefully and positively for health and wellbeing, but also possibly some of the changes that may have happened, but not necessarily intentionally or not necessarily in a positive way for health. We also recognise that change occurs for a number of different reasons. Sometimes it can be legislation, and sometimes it can be conscious choices and policy that's introduced within a school for themselves. But we also recognise there's an evolution to the school environment. And if we think back to the early days of healthy schools or working with schools on health and wellbeing, we would have been talking about the same topics, but in a very different way. And the fact that things have changed as much as they have is a testament to the progress that has been made over that time. So we're still talking about tobacco now, we're still talking about smoking. We're talking now about smoking at the school gates, even around the perimeter of the school, in the school grounds. We're talking about new innovations such as e-cigarettes and how we handle those for good rather than harm. When I first started working with schools, I'd have been talking about trying to encourage the head teacher not to smoke in his office and the staff not to smoke in the staff room. Something which we probably couldn't even conceive of imagining today. But it shows how far we've moved. You know, the other thing I can remember is visiting schools with tuck shops, with, you know, which would rival the sweet counter at Woolworths. For those of you like me who are old enough to remember the sweet counter at Woolworths. So things have moved on really quite substantially. So when we're looking at school environment, I don't anticipate that we'll always be measuring the same things, because it will change and we want to see that constant evolution. We can also use the school environment questionnaire and that kind of approach to help us understand the need for support and guidance. So one of our jobs in Public Health Wales is to help schools and those supporting schools to actually take positive action to improve health. So where there are areas that many schools across Wales are experiencing difficulties with or would welcome additional guidance or help, it's really helpful for us to be able to identify that. And something like the school environment questionnaire enables us to do that. The approach that we're taking with the whole school approach to mental and emotional wellbeing framework for Welsh Government is obviously helping schools to take a whole school approach, helping them to think critically about all of the different dimensions of their school, what they're doing really well, areas where they think they can improve. But we're really keen to gather from that process some of the issues that are coming up time and time again across Wales, so that we can feed that in at a national level or regionally to help take more coordinated action. We know quite a lot about how the school environment promotes health and wellbeing. We've talked about some of those issues already. We know, for example, that school leadership is fundamental. There's a strong relationship between leadership commitment to health and wellbeing and good pupil outcomes. But we want to understand more about that. And the unique opportunity that this particular survey and the companion student survey shows and gives us is that we can investigate those two things together. We can look to see where the relationships are, the things that seem to be most commonly correlated, if you like, or associated with health and wellbeing outcomes. And that's something that we want to continue to be able to work with academics to explore in more detail. And without both surveys, we would find that quite difficult to do. The other thing that obviously is really important from our point of view is evaluation. We want to be able to understand whether national or local policy and strategy is actually having the impact that we'd hoped. So, for example, if we think about when we implemented the CAMS InReach as a pilot, we were able to do some work through the school environment questionnaire that year to gather a baseline, to understand some of the issues that schools were experiencing, what their relationships with CAMS services were like now, and that helped us to shape that work moving forward. We're working on a programme at the moment called the Daily Active with Sport Wales, Natural Resources Wales and Welsh Government, And it's about trying to help schools, trying to make it easier for schools to maximise the potential of the school day for physical activity, not just what they do in PE, what they do in other lessons, the opportunity for outdoor learning, for activities in breaks, before and after school. And the potential of this school environment questionnaire is that we can track over time how that's actually going and whether or not we're seeing the kind of changes that we'd like. It also helps us to do a bit of a deep dive, to explore areas in more detail, to understand where some of the issues might be that we might need to do a little bit more work. So we've asked in the past perhaps a bit more questions in a bit more detail about food, for example, the food environment in school as part of the Healthy Weight, Healthy Wales strategy development. And that was designed to help us think about where we might be able to do a bit more work. And I know this next questionnaire is going to ask about the curriculum. And again, a really important area at the moment as we move forward with the new curriculum for Wales. So in summary, the school environment is fundamental influence on both learners and staff, their health and well-being, and for pupils, their attainment. So it really needs to be fundamental in terms of the way we think about health and well-being. And we know that schools can make conscious and unconscious changes and decisions which impact on outcomes. And we need to be able to understand and track that. We need to be able to help mitigate the impact of the changes which might be less favourable to health and well-being and maximise the potential of those that have the greatest potential impact. We also know that, generally speaking, in public health, and school health is no different, interventions and action that focuses on the whole school, the whole setting, the whole population, generally are much more effective at reducing inequalities than those that focus on individuals. So the big challenge that we have at the moment, both in terms of health inequalities and educational inequalities, will mean we need to look at the school environment, the policies, the practices, the way in which a school operates to try and achieve the greatest potential for all young people. Thank you very much.